Right behind me is a gathering of key players in the health sector deliberating on how to revitalize the sector. Today on Soundhealth, our focus is on the role of public-private partnership in strengthening the healthcare system delivery in Nigeria. I'm Olasunbo Modupe. Welcome to the show. It's still Soundhealth on Lagos Television, and today we are looking at how to revitalize the health system in Nigeria. And I have with me Mrs. Njide Indile, the country director of Pharmaccess Foundation Nigeria. Welcome to the program, Doctor.
Thank you. Nice to be here.
Okay, in Nigeria, unfortunately, about 50% of members of the public still don't have access to quality health care. Why is this so?
Well, people don't have access to quality healthcare because they are not able to pay for healthcare services, or even if they were able to pay for it, the facilities are not available. So when you talk about payment for healthcare, you're talking about either health insurance, but right now, a majority of the people pay out of pocket. That means they have to pay cash when they go to use the healthcare services. And a lot of times, unfortunately, these people cannot afford to pay for healthcare services. So they'd rather go to the churches and seek treatment or blessing to get well, or they self-medicate by going to the pharmacist to buy medication to treat themselves. So unfortunately, that's true, that 50% of the population doesn't have access to quality healthcare services.
Okay, recently the world celebrated World Health Day. How would you rate the country's healthcare system? How has the country fared in the 21st century?
Sadly enough, I must say that the Nigerian healthcare system that I knew from many years ago seems to be regressing. There is dilapidated infrastructure, there's not enough budgetary allocation to maintain and sustain the healthcare system in a very efficient way. So we're finding that really a lot has to be done. There has to be some major disruption to get us back to where we need to be in terms of the states providing, and federal as well, providing quality healthcare services to the citizens, either through public-private partnerships where private sector can help provide a gap in service delivery through running some of these PHCs. So yeah, unfortunately things have not progressed the way it should have,
Okay.
and there needs to be an urgent disruption in the way services are delivered in Nigeria.
In the advanced world, primary health care is key in ensuring sustainable and effective, efficient healthcare service delivery. Unfortunately, the reverse is the case in Nigeria. What are some of the challenges affecting this system to work?
Well, I think part of the challenge with the primary healthcare system is inadequate funding and management. As we know, we're supposed to have one PHC per ward. And in Nigeria, the statistics has it about 24,000 primary healthcare centers all over Nigeria, of which less than 20% are fully functional. When I say fully functional, they are staffed, properly staffed, medication available, and people can actually access and get services at the time that they need it. So that is part of the problem. When you have just less than 20% working, then technically people don't have availability or access when they need it. And unfortunately, primary health care is the crux. That is where 80% of people need to go to when they fall ill, because we know by statistics and data that predominantly we go to hospital for primary health care services, pain and, minor ailments, malaria, typhoid, and so on and so forth. So if we can fix a primary healthcare system, which is the closest to the people, then we will make tremendous progress towards making healthcare available.
Okay, so far so good. How would you rate the intervention ever since it kicked off?
Well, it hasn't totally kicked off in Lagos State. We are still going through the contracting process. The private sector entities that will take over the facilities have been identified. They're going through the contracting process with the Ministry of Justice. And once that is done, then they can then apply for the loans and start refurbishment. But in Delta State, which is one of the examples which was showcased today, it has actually kicked off. And we had some fantastic statistics today of people accessing care in remote areas where there was no healthcare facility in the first instance. So I think that this could potentially be a disruption and a major policy change if government creates the enabling environment to allow private sector to run this.
Could public-private partnership be attributed to the National Health Insurance Scheme with special focus to the Lagos State Health Insurance Scheme newly introduced?
No, well, it is not, when I say similar, they work hand in hand, because the insurance scheme is the system that will feed enrollees and patients into these primary healthcare centers. So you've created a law which enables mandatory health insurance. That is enabling the demand side. But if you buy insurance and you want to access care and there's no facility near you, then it creates a problem. So the demand side creation is good, but you have to make sure that the supply side is also ready by making sure these primary healthcare centers are working and available.
Federal government just introduced the National Action Plan for Health. Do you see this working?
Well, I have to say there are quite a number of acts and laws and initiatives, but it's important to get started, to start implementation. I know that government has all good intention, but we in the private sector or development world, we like to put our money on the table. And when I say put our money on the table, we like action. So in as much as there are initiatives by the government, we want to test, especially for us Pharmaccess, we want to test, we want to try it, see that it works, document it before we have this kind of conferences. So the reason we're doing this today is because we've tested and we want to show what is possible. So we are willing to support government, but the most important thing is you have to get started. You have to do something. Then from there you can gain momentum.
It goes beyond public-private partnership. How do you put in place quality control for effective service delivery?
So we have it all covered because at Pharmaccess we have a very integrated approach. Okay, so when you take the loan, invariably you are adapting a safe care methodology into the primary healthcare center. The safe care methodology is a quality improvement methodology that ensures that the quality of care within the facility is up to par, focusing on the infrastructure, the people, and the processes to make sure that they work hand in hand in a system approach to ensure good health outcomes. So as you're taking the loan to upgrade the facility, you're also getting safe care methodology.
Okay. Should we expect a communique at the end of this event, or what is the thrust?
It will be a communique. As you can see, there's quite a number of government officials here. Even a representative of the Honorable Minister of Health is here. We have a Commissioner of Health and several people from the Ministry of Health, as well as a lot of private sector. So what we're doing today is showcasing what is possible, what has been done, and what is possible. And the important thing is to make sure that we document some of the things that have happened, but use it as a tool to advocate for policy change or an enabling environment for more PPPs to thrive. That is the whole essence of this. So it's an advocacy tool. Let people know what we're doing, let people know what is possible, and to see how we can drive that process forward.
Mrs. Ndidi, as we wrap up this segment, what is your final word to lawmakers and key stakeholders in the health sector?
Well, my final takeaway really is that government cannot do it alone. We have seen that government in its budgeting allocates 80% to recurrent expenditure and just 20% to capital expenditure. So there's a huge gap. And we're saying that private sector has the wherewithal, has the resources to be able to support government to make healthcare system work. So let's create that avenue for private sector to participate and work to support government to revitalize our healthcare system.
All right, thank you so much for sharing your thoughts with us on how to strengthen the health sector.
Okay, thank you so much for having me. Thank you.
All right, has been Mrs. Njide Ndele, Country Director of Pharmaccess Foundation Nigeria, on how to strengthen the country's health sector. Soundhealth continues with trending and home essentials. Please stay with us. The program continues in a moment.
This week on sexual and reproductive health rights. Sexual and reproductive health, including family planning, is critical to the fulfillment of human rights. Family planning is widely recognized as one of the most cost-effective health interventions. Decades of research have demonstrated that modest investments in family planning can save lives and dramatically improve maternal and child health. There is a growing push in the development community to reprioritize family planning because of the cross-cutting role it plays in achieving broader development goals, including the Millennium Development Goals and poverty reduction. Most fundamentally, access to sexual and reproductive health services enables individuals and couples to plan their sexual and reproductive lives, forming an essential aspect of human dignity and freedom. as pronounced at landmark United Nations conferences on women, population and development in Cairo in 1994 and Beijing in 1995, the right to control the number, spacing, and timing of one's children is fundamental to exercising reproductive rights. To do so means that individuals and couples must have the information and means to make informed decisions regarding their sexuality and reproduction. Moreover, the human right to family planning enables the exercise of other human rights, such as gender equality, for example, by allowing women to expand their life opportunities, increase their negotiating power, and raise their socio-economic status.
This is why we say thank you on today's edition of Sound Health. Remember, for effective and quality healthcare delivery, public-private partnership is the way to go. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.